Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde, bon après-midi et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre. Dr. Russell.
Thank you, Bruce. Merci.
Good afternoon. This week, we have seen 3 more New Brunswickers die from the effects of COVID-19. This deeply saddens me, and I'm sure that every New Brunswicker will join me today in offering heartfelt and sincere condolences to the bereaved families. Your loss is our loss, and all of New Brunswick grieves with you today. These deaths underscore the seriousness of this pandemic and the vital urgency for everyone to follow public health guidance and advice.
This week, we have seen 3 more New Brunswickers die from the effects of COVID-19. This deeply saddens me, and I am sure that every New Brunswicker will join me today in offering heartfelt and sincere condolences to the bereaved families. Your loss is our loss, and all of New Brunswickers grieve with you today. These deaths underscore the seriousness of this pandemic and the vital urgency for everyone to follow public health guidance and advice. Our situation remains grim with no let-up in rising case counts across the province. There were 200 new cases of COVID-19 reported in New Brunswick between December 7th and January 7th. There were 100 cases reported in 27 days, followed by 100 cases in just 4. That's an increase in terms of doubling time that we're not comfortable with at this moment. As of today, 2,161 New Brunswickers are in self-isolation. So they have 14 days ahead of them where they're waiting to see if they develop symptoms of COVID-19, and they will be getting tested on day 10 of their self-isolation. Une équipe provinciale de gestion rapide des éclosions a été envoyée aux résidences Jodin à Edmundston, un foyer de soins de 159 résidents qui compte 221 employés. Des tests de dépistage
And 221 employees. Mass testing is occurring there today. And yet, what we are experiencing in New Brunswick pales in comparison with the outbreaks now underway just across our northern and western borders. In Maine, there are more than 17,000 active cases of COVID-19, and the state has seen more than 450 deaths to date.
Brunswick counties, our nearest neighbors to the west, have over 1,000 active cases and are adding to this total at a rate of 100 per day. Quebec is averaging more than 2,500 new cases per day and has experienced 8,700 deaths due to COVID-19. Our neighbors' houses are on fire, and the hot embers are flying onto our roof. If we don't take necessary actions to keep this fire at bay, it will engulf us as well. But please let me say that most of New Brunswickers are doing the right things. Most of New Brunswickers are following public health guidelines. But the problem with this virus is that it only takes a few small number of people to contribute to outbreaks that lead to entire zones going to orange and the entire province going to orange. So that's why we all have to take the steps to protect ourselves and our communities. Today, there are 23 new confirmed cases of COVID-19 in New Brunswick. The new cases are as follows. In Zone 1, which is Moncton and southeastern New Brunswick, 7 new cases. In Zone 2, which is the St. John, Kings, and Charlotte counties, 2 new cases. In Zone 3, which is Fredericton and the St. John River Valley, 4 new cases. In Zone 4, which is the Edmundston Grand Falls region, 5 new cases. In Zone 5, which is the Campbellton Restigouche area, 4 new cases. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. There are now 246 active cases of COVID-19 in the province. 3 New Brunswickers are currently hospitalized due to COVID-19. I ask you again to keep everyone and those people in your lives that have been affected by this disease in your thoughts and prayers. Aujourd'hui,
Today, I'm announcing that there are 23 new confirmed cases of COVID-19 in New Brunswick. The new cases are as follows. In Zone 1, 7 new cases. This is in Moncton and southeastern New Brunswick. In Zone 2, St. John, Kings, and Charlotte County, 2 new cases. In Zone 3, Fredericton and the St. John River Valley, 4 new cases. In Zone 4, Edmundston, Grand Falls, there are 5 new cases. In Zone 5, which is Campbellton, Restigouche, 4 new cases. 1 new case in Zone 6, which is Bathurst and the Acadian Peninsula. There are now 246 cases of COVID-19 in the province. 3 New Brunswickers are currently hospitalized due to COVID-19. I ask you again to keep everyone whose lives have been affected by this disease in your thoughts and prayers.
Recall that in the early days of the pandemic, the government released modeling that attempted to show how COVID-19 might impact our province. The models projected that New Brunswick could see up to 5,600 COVID-19 deaths over the course of the pandemic. Even with stringent public health measures, the best case scenario was for 550 deaths. Thankfully, we have experienced only a fraction of that loss to date, thanks to the efforts that all New Brunswickers have made to control the spread of the virus. The province of Quebec is currently averaging more than 2,500 new cases of COVID-19 each day. But if they were reporting at the same rate of infection as that is now being seen in New Brunswick, they would have approximately only 250 cases a day. Make no mistake, 12 lives lost to COVID-19 is 12 lives too many. But we can take some solace from the success we have had in limiting the number of deaths and severe illness during this pandemic. And I am very proud of all New Brunswickers who have been doing so much hard work to keep those numbers as low as possible.
Quebec has been averaging approximately 3,000 new cases of COVID-19 each day. If they had the same rate of infection as we have in New Brunswick, they would only have 250 new cases a day. Make no mistake, 12 lives lost to COVID-19 is 12 lives too many. We can take some solace from the success we have had in limiting the number of deaths and severe illness during this pandemic. I am so proud of all of the efforts that were made by New Brunswickers, these people who have made everything they could to keep the numbers of cases as low as possible.
We are not out of the woods by any stretch. While the dire projections made last spring have not yet come to pass, we may yet experience a surge in hospitalizations and deaths as we are now seeing new cases. Because we have over 200 active cases, we do expect that some of those people will become hospitalized. But to keep this from happening and to keep new cases from spreading, we all must take simple actions to prevent the spread of the COVID-19 virus, such as wearing a mask, maintaining physical distance, sanitizing your hands, and reducing the number of close contacts. And let me be clear that in the orange phase, your household are your close contacts, because those are the people that you were spending time with without wearing your mask. If you are outside your household and you're not with the support person who's attributed to your household, you must wear your mask at all times. Any of the transmission that we're seeing in workplace environments or any social settings outside, which shouldn't really be happening, is as a result of people being less than 6 feet apart without wearing a mask for more than 15 minutes. These actions, keeping your mask on, keeping your distance more than 6 feet, will protect your families, as well as your healthcare workers and our most vulnerable citizens, as well as our economy. These are life and death choices They affect people's lives and they affect people's livelihoods. We are continuing to address the spread of infection in nursing homes in several communities across New Brunswick. Our public health teams are also conducting follow-up swabbing for tests at Fundy Royal Manor in Hillsborough as well as the Tobique First Nation. And I want to thank these teams for their rapid response to these outbreaks. Au cours des prochaines
We will be moving forward in the coming days to accelerate our efforts to vaccinate residents of long-term care homes, including those facilities where outbreaks are now underway. We are now better able to provide vaccines across the province. As the supply increases and our ability to store and distribute these fragile vaccines improves.
Moving forward in the coming days to accelerate our efforts to vaccinate residents of long-term care homes, including those facilities where outbreaks are now underway. Keep in mind, though, that the vaccination, that first dose, takes 14 days to really have a protective effect. So there are people who have been vaccinated within the last 7 days, but the outbreaks in some of those places took place during that time frame, so the full protection is not there yet. But again, our goal is to continue with this process. We are now better able to provide vaccines across the province as the supply increases and as our ability to store and distribute these fragile vaccines improves for the high-risk populations that we have designated. So starting on Friday, we will be conducting vaccine clinics at long-term care facilities in Zone 2, including those operated by Shanix. In the facilities with active outbreaks, our priority must be on limiting the further spread of the virus. We must be certain that any COVID-like symptoms that emerge are actual infections rather than side effects to the vaccine. In highly impacted areas of the facility, we need to focus on critical infection control measures, outbreak control, and avoid confusing vaccine reactions with true infection. It is also not recommended that patients with active infection be vaccinated. As a result, there may be some sections of facilities where there will be a delay in getting vaccine. And again, I have received numerous emails, I know many of my colleagues have as well, around vaccination of all populations, including people in long-term care facilities, including people in long-term care facilities with outbreaks. Staff from the assisted residential facility and unaffected nursing home units can sign up for clinics managed by Horizon Health Network as long as they have had no contact with the COVID-infected areas in the last 14 days. And again, I know there is disappointment out there. I know there are people who wish they were higher up on the list and that they didn't have to wait. I hear these complaints and concerns expressed every single day. We talk a lot about numbers at these briefings, but at its heart, our efforts to slow the spread of the COVID-19 pandemic are not about numbers. They're about people. Parce que le Nouveau-Brunswick est une petite...
Because New Brunswick is a small place, the face of this pandemic is familiar to us all. A neighbor, a family member, a friend, a colleague, or a classmate who we know very well. Our collective success comes from protecting and supporting one another. We must continue to do this. The last leg of our journey through this pandemic will be the most difficult. The challenges ahead are greater than any we have faced thus far. We need to redouble our efforts and recommit to following public health guidance and directions.
Let up our efforts until the majority of New Brunswickers are vaccinated against the virus. Now is not the time to become complacent. We have worked so hard as a province to get where we are. We do have more work ahead of us, so we must stay the course. Please get the COVID-19 Alert app, and if you are notified of being positive, use the app to enter your one-time number. It is an anonymous way to do your part in protecting your fellow New Brunswickers by notifying others who may be close contacts. Please stay home and get tested, even if you have mild symptoms, even if it is inconvenient. We do appreciate the efforts that people are taking to make sure that they follow these directions. Please avoid travel. Please self-isolate at a location away from your household if you have that option. Please disinfect surfaces. Please disinfect your hands with hand sanitizer. Please be kind and be patient. Be patient with this process of the vaccine rollout. It will take time. You will eventually get your vaccine. Please be patient with contact tracers. Please give a shout out to all the people you know who are working on the front lines trying to contain the virus. We will get there together. Thank you very much. Merci.
Good afternoon. Bonjour. This week we learned the sad news that 3 more people in our province have passed away as a result of COVID-19. On behalf of all New Brunswickers, Marcia and I offer our sincere condolences to the families and friends of these individuals. COVID-19 has been the cause of 12 deaths in our province since the pandemic began. Every single person who dies because of this virus is a tragedy. And what is worse is that each one is avoidable. These individuals had their lives cut short. They lost out on precious time they could have spent with their loved ones. C'est pourquoi.
This is why we need to take this situation seriously. We must do everything we can to protect New Brunswickers, in particular our most vulnerable residents.
For now, our entire province remains in the orange level with heightened restrictions. And yet we still don't see the compliance we need to, nor are we making the progress that we need. We have had 260 new cases since New Year's Day, and we're at the highest case count to date, more than double our previous highest number. This should serve indeed as a wake-up call for all New Brunswickers. Some people have been asking whether the province needs to move back to red to turn things around. Et ce moment,
Right now, the situation is concerning, but it is contained.
now we are in orange. But if we were to see out-of-control community spread, if our hospitals were to start becoming overwhelmed, if public health measures were no longer having an effect, or if outbreaks were unable to be controlled through testing, tracing, and self-isolation, moving to the red level is indeed a possibility. But this is an option of last resort. If we did so, it would mean moving K-12 schools to virtual learning only. We would need to shut down many businesses. The potential impact on the Brunswickers' mental health and on our economy would be severe. I know many businesses are feeling the strain, and most, I say most, but not all, are complying with their operational plans. We are unfortunately still finding non-compliance. Earlier this week, inspectors visited 172 sites. The good news is that the majority of these sites were fully compliant. And 99.4% of all patrons were wearing masks. There were, however, some causes for concern. Only 88.9% of employees were wearing masks. 2 employees in 1 retail business were determined not to wear a mask, and each of them received a ticket. Inspectors found that 2 businesses were not following their COVID-19 operational plan as required, and another 14 had operational plans that were not adequate. They also found that 23 businesses, more than 13%, at this time, many, many months after the beginning of this pandemic, they had no plan at all. Nearly 10 months into a state of emergency, that is simply not acceptable. Les inspecteurs et les
Inspectors and peace officers have treated most of these cases by giving them more information. 2 businesses were required to close their doors, and 9 others received written directives to help them respect the rules immediately.
Informing and educating businesses that they need to have an operational plan has come to an end. Going forward, when inspectors and officers find businesses with inadequate plans or with no plan at all, they will be issuing fines or shut them down. Businesses that fail to follow the rules will be subjected to up to $10,000 of fines. Les entreprises doivent avoir un plan.
Businesses must have an operational plan. and they must respect this plan strictly. This is not an option. Each business has to do it to protect its employees and its clients.
I know it may not feel like it right now, but this is not going to last forever. We have been administered vaccines to priority groups identified in our vaccine plan as quickly as possible and as vaccines are available. We are now posting information on our vaccination efforts through the COVID-19 dashboard. You can check the dashboard for weekly updates on the number of doses of vaccines we have received, the number that have been administered, the number held to serve as a second dose, and the number of people fully vaccinated.
As the number of vaccines increases, we will be able to have more precise information. This will allow the public to see clearly how much progress we are making. And everyone will be able to see where they are in the plan.
This morning, a shipment of 2,700 doses of Moderna vaccine arrived in the province, which will be used to vaccinate residents and staff of long-term care facilities. This week, we also received 3,900 additional doses of Pfizer-BioNTech vaccine. Several clinics are taking place over the coming days for healthcare workers and long-term care workers in direct patient care, including but not limited to physicians, nurses, and LPNs. This week, we will administer 975 doses in St. John, 975 in Fredericton, 488 in Campbellton, and 488 in Edmonton. A 3-day clinic also started today in Moncton to deliver a second dose to 1,034 healthcare workers. We do not have any doses that are unspoken for. The only vaccine sitting in freezers has been set aside to ensure everyone who has had their first dose is able to receive their second in a timely manner. Now more than ever, it's clear that COVID-19 is all around us. And as you heard Dr. Russell talk about our communities to the north and to the west, just today, Maine reported 808 new cases and 8 more deaths. There have been more than 32,000 cases reported in the state since last March. And right now in Aroostook County, 746 active cases. I want to remind everyone who has been outside of the province and returned to New Brunswick, they must complete a 14-day self-isolation. Some people are clearly not following what is required. We have had reports of a large birthday party, which as many as 40 people, that sparked a number of positive cases. In other cases, people have attended family dinners, even though they had COVID-19 symptoms. We've heard that a card game resulted in a number of cases, far beyond those who attended the actual get-together. There are other stories that we've heard about reckless behavior. One situation where an individual goes to a paint store and tells the salesperson, I needed to get some paint. I'm home in self-isolation and I need something to do. It's not out shopping for paint or shopping for anything else that individual should be doing. They could paint in their house, but someone else should do the shopping for them. These are what seem like innocent acts that can cause the virus to continue to spread. We must each have behavior conducive to following public health rules.
Self-isolation does not allow people to go out for a walk in their neighborhood, to get a cup of coffee at a drive-thru. Self-isolation means that you have to stay inside, completely apart from others. You must do what is necessary to have food and other necessary products delivered to you.
You are not permitted to leave your property for any reason other than a medical emergency. You cannot have any visitors, and you must avoid contact with anyone else in the household. That means eating and sleeping separately and maintain at least 2 meters of physical distance at all times. Certaines personnes ne respectent pas.
Some people are not respecting these measures, but I know that most New Brunswickers do. Unfortunately, some people will still be exposed to the virus without having done anything wrong.
Telling the truth about the places you've been and the people you've spent time with is the only way contact tracers can do their job properly. It's the only way we can make sure we contain the virus once again and get the whole province back to the yellow level. La dernière semaine n'a pas été facile.
The last week has not been easy. I would like to thank our contact tracers, healthcare workers, and the staff in long-term care facilities. Thank you for working so hard to help us control the situation. We've also seen an increase of cases in schools recently. I would like to say thank you to teachers and staff in schools in New Brunswick for their patience and their hard work in this difficult time.
Although we have seen cases in people who attend or work in school, we have not seen the virus spread widely within the school system, which means the system is currently working. We are certainly facing a setback at this time. We do have schools that are impacted, but we must together get back on track. We must follow the rules. We must just take the extra steps necessary to get this back under control before it's too late, as we've seen in other parts of the country. Let's all do our part to get New Brunswick back to yellow as soon as possible. Let's look forward to the vaccinations. Next summer at this time, let's say we survive COVID. Let's say we have a province that is moving forward once again normally. Thank you. Merci.
Thank you, Premier and Dr. Russell. Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Please ensure your microphones are placed on mute. Laura Lyle, CTV.
Thank you, Bruce. This question would be for Dr. Russell. Dr. Russell, there is a sense of urgency, especially for families at Parkland St. John when it comes to vaccinations. What is the timeline for residents and staff there to be vaccinated? And how many vaccinations are being directed there? And to any other long-term care homes in the St. John region?
So I do understand that sense of urgency that people are feeling. I do have those emails in my inbox, so I'm hearing from people who have those concerns. And up until now, the vaccine manufacturers had advised against administering the vaccine to anyone currently experiencing who had COVID-19 at the time. And in a communal setting during an outbreak, all residents really need to be considered and treated as if they are positive cases. So that's why everybody's self-isolating due to the incubation period of the virus. So we were doing the several times a week testing of all of the residents and all of the staff, even though we know that it's a snapshot in time and it's not really going to tell us that it's not going to guarantee that someone will not develop the symptoms of COVID-19 since the time the test was administered. So even after receiving the vaccine, the individuals can still potentially become infected and spread the virus. And that first dose of the vaccine really takes 14 weeks to take effect in terms of immunity. And it really takes that second dose, whether it's 21 or 28 days after that, to really get full immunity. And even then, you need another 7 to 14 days after that to really reach the best immunity level possible. But even with the best immunity possible, it means that the person who received the vaccine is the person who is protected from serious symptoms, but it doesn't necessarily protect others around them in terms of getting infected and shedding the virus. So the reason for not vaccinating in Parkland St. John, we did investigate whether the vaccine can be safely administered in a situation of an outbreak. And it does require work. So I think that's the part that people might not quite understand, is that it is really, it takes a lot of effort to ensure proper infection and prevention control. And we really needed to dedicate our time and effort and resources towards that. That was going to be the most protective thing at that time. We are now able to move forward with with vaccinating residents in the facilities with an ongoing outbreak, with the exception of the most affected units. But again, I just want everybody to have patience and understanding that it is very complex dealing with all of these situations concurrently. So we do really ask that people have patience at this time. All long-term care facilities will be prioritized based on a risk assessment that includes whether they're in an active outbreak or a prior outbreak against vaccine supply at any given time. And there are 8 long-term care homes in Zone 2 that will be vaccinated. And then in terms of the doses, we've got 2,700 doses of Moderna arriving in the province today, and all of the Moderna vaccine will be going to vaccinate residents and staff of long-term care facilities. We have an additional 3,900 additional doses of Pfizer-BioNTech vaccine, and that's going to be received this week. And a number of clinics are going to be taking place over the coming days for healthcare workers. So again, this is a drop in the bucket in terms of the entire population of New Brunswick, but just know that that 12-week rollout phase for the first doses of the vaccine are prioritized for long-term care facility residents, healthcare workers who have direct contact with COVID patients, First Nations adults, and also people 85 and over. So whether you're at the beginning of that rollout in the first week or 2, or whether you're in the 12th week, that priority group will be done over the course of the next 12 weeks.
Thank you, Doctor. Thank you, Ms. Lyle. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, if a vaccine is 95% effective, does that mean some people may still experience mild symptoms if they come in contact with the virus, or does it mean that the vaccine doesn't work on 1 out of 20 people? What exactly does it mean, and how long do we currently think immunity the vaccine provides lasts?
So there are many unknowns, Vicky, at this time. And so the efficacy right now in terms of protecting individuals, we know that people can still get COVID-19 with having been vaccinated. We know that if they get the COVID-19 infection, they can possibly spread it to others. So that is why we can't take any chances at this moment in time around continuing with our public health measures, probably right through until September, when the majority of New Brunswickers will be vaccinated. So again, between now and then, I know we will be learning a lot in terms of data, because right now we only have immunity data for probably about 60 days post-vaccination after that second booster. So, so there's going to be a lot more information that we'll be following at this time.
Thank you, Ms. Hogarth. Thank you, Dr. Mathieu Roy-Como, l'Acadie Nouvelle.
Mathieu Roy-Como, Acadie Nouvelle. My question is for the Premier. We announced today the delay of trips to the north. Inaudible comment. Inaudible comment, please repeat. I can't hear it. Repeat. Maritime Bus announced today that they were going to delay trips to the north between Moncton and Fredericton because the owner feels optimistic after discussions with municipalities. They say they can't save the system on their own, and the province needs to help. Bus needs support throughout the pandemic. Is it possible that the province would send some funding towards Maritime Bus before the end of the pandemic?
Yes, it is possible. We are encouraged by the municipalities getting together because the restart money that the federal government had moved to municipalities, it is for COVID-related expenses, and this is confirmed as a COVID-related expense, which I think is always the kind of the criteria that we're looking for. Is real, as is every activity that we've seen around people moving around on mass transit. So I'm encouraged to understand what the municipalities are agreeing to, and then how we can move forward in this file.
Merci, Monsieur le Premier ministre. Merci, Monsieur Roy. Comment Marie Sutherland, CBC.
Marie Sutherland, CBC. Ma question est pour Dr. Russell.
To the rest of the Atlantic provinces in this second wave. And I know you said, I think it was at the last briefing, that this is partly because we're the gatekeeper province that others have to travel through, but we were the gatekeeper in the first wave as well, so I'm wondering, is there something else that's contributing to this wave? And if not, if it is because we're the gatekeepers, and that a risk we should be minimizing by further tightening the border?
There are many hypotheses around what's happening with our numbers right now in terms of how everything got started, but the majority of the cases are travel-related, and they've transmitted to their household members as a result of not self-isolating properly. We have had Christmas gatherings as well as New Year's Eve gatherings with people who had attended with symptoms that have contributed to this. We also have people who have attended workplace settings with symptoms. So we know that there was a large drop in testing over the holiday season, and so that has definitely contributed to what's happening right now. So I would say that the biggest issue that we're facing right now are people really not taking into account the major increase in risk that's happened because of all the cases that are increasing in numbers all around us. So we have recently tightened our border control measures because, again, this is a Swiss cheese approach. So we could tighten our borders, we can tighten our testing, we can tighten our restrictions, we can tighten our messaging around staying 6 feet apart and wearing a mask and disinfecting your hands and staying to your one household bubble with your support person. But unfortunately, even since transitioning to the orange phase of recovery, these things are not all working because we're still seeing transmission. So we are at a critical juncture right now, and I don't really know how best to characterize this in any other language other than to say we are at a critical turning point whereby we've gone to the orange phase and we're still seeing transmission after the orange phase directives have been and restrictions have been put in place, which means they're not working entirely. And why is that? So we are examining why aren't they working. And what we're seeing is with the help of our public safety partners, we are seeing that there are businesses that are still don't have, as Premier Higgs said, that still don't have operational plans. We're still seeing complaint-based situations whereby there is a risk in some workplace settings. Again, when people have symptoms and don't get tested, that is a risk. When people have had gatherings that really shouldn't have happened in terms of the numbers and the type of setting that it was happening in, again, not great situations. So we do have a collective need right now to really think long and hard about our approach in the sense that we know the majority of the population of New Brunswick has been complying with public health restrictions and measures. And I think that's probably the most frustrating thing for that population right now, that the majority of people who are complying with public health measures and are taking all the steps to protect themselves and their communities, again, when there's things happening around them that are very clearly going against what public health restrictions and public health measures are trying to achieve, that we can't move together as a province. So we need 100% of the population to move together as a province to address these issues right now of COVID-19, because it only takes 1 or 2 or 3 individuals to start an outbreak in a zone that can then spread to other zones and then lead to a province shutdown. So unfortunately, the odds are not great in terms of, yes, you can have 95 or 97% of the population complying, but that 3% can derail us. So I'm urging every single person, 100% of the population, to follow public health guidance, abide by the restrictions. It is the only way that we're going to prevent what we see in other jurisdictions right now. And it can't be more blunt than that. Thank you.
Thank you, Ms. Sutherland. Thank you, Dr. Silas Brown, Global TV.
Hi there. This is for anyone, whoever would like to answer this. Dr. Russell, you did just speak about that it doesn't appear that the restrictions of the orange phase are entirely effective at this point. And just a quick look at the phase triggers, by my count, it appears that likely about 3 are being hit that could lead back to a going back to the red phase, looking at doubling time, vulnerable outbreaks in vulnerable situations, and non-compliance. So I'm curious, has the threshold for the triggers to go back to red been hit? And if not, what are we missing here, and how close really were we?
So Dr. Russell will talk about the triggers in meeting those thresholds, and I guess at this point we're seeing kind of a steady, daily number, which is concerning because we'd like to see it go down, and we're absolutely, hoping that will be the case over the coming days. But what I pointed out earlier were some very flagrant violations of what are known concerns, what are outside of public health rules, and particularly in a zone orange category, and it's like we're okay, we can do this anyway. So the comments that I made about the enforcement, the findings, ramping it up. I think if we think about the concerns around Halifax prior to Christmas time, and during that phase, there were some very strict measures put in place at that time. We've been very successful here going to zone orange with the contact tracing being very effective, and the caseload dropped within a couple weeks, maybe 3 weeks, and we didn't see the continuation like we're seeing right now. So it is different, and it's different because people are not following the rules, and not following the rules is going to have consequences. So the enforcement, the fines, the shutdowns are going to increase, and this isn't an idle threat or an idle issue that we're just saying that, we just got to be more difficult here with individuals. It's like we've asked people to be part of this solution because it's a must. People are dying otherwise. We're seeing it all around us. So we have an opportunity in New Brunswick to continue the great work that's been done for the past 10 months, or we can lose it all. And we can lose it all from one more birthday party or one more big event that people say, oh, it can't happen to me. Well, that's where we are right now. So when enforcement officers are out there, I don't need to hear any complaints about how they're dressed, but I will be asking them to enforce the rules because we must.
Hi, was that Silas that asked the question? So Silas, we do have our meetings every day, several times a day, to continue to examine the triggers and the patterns of transmission that we're seeing. So we have a beautiful map with all the cases outlined in each and every zone, the connections between each and every one of them, the doubling times, the testing positivity rates. We can tell you which zone needs to get their testing rates up, so we can be confident that we're not missing anyone. So obviously, it is heartbreaking to hear that, again, there's just a small percentage of New Brunswick's population that is putting the rest of the population at risk. That is heartbreaking. So I am imploring everybody to really take all the steps they need to help cooperate with public health and get us back on track sooner rather than later. So the triggers are 3 different categories. The first category is the epidemiology category, and that is about doubling time, et cetera. It is about case counts and its transmission type, including community transmission and including vulnerable population settings like nursing homes. We do have 3 cases right now that are still under investigation that we are worried could be community transmission. We're still working on that. And now in the second category of triggers are the public health triggers. So that includes the time that people take to contact trace, test, and self-isolate, and then also whether people are complying with public health measures. So, even if it's just a small percentage, 1% of the population not complying with public health measures is actually a large number in light of the risks of COVID-19 and the exponential growth in cases that we see very rapidly in each zone. So we don't want to continue to see that, obviously. The other one that we follow very closely with the RHAs every single day, we get a capacity picture of, what's the ICU capacity, what's the hospital bed capacity, what's the healthcare worker capacity, what are the admission rates like and discharge rates like. So we have a very specific picture of what the risks are to the healthcare system. Will surgeries need to be postponed? Will certain services not be able to be offered because healthcare workers are self-isolating at home as a result of COVID-19 being a close contact of somebody? And that impact on the capacity of the hospital is looked at also. So yes, we look at those every day. Are we close to going to red in any zones? Well, again, that is a last resort, and anything that we can do to prevent that, we will do.
Thank you, Doctor. Thank you, Premier. Thank you, Mr. Brown. Harry Forstall, CBC.
Thank you, Bruce. Dr. Russell, this is a question for you. Epidemiologists we've been speaking with make the point that now that we know the delivery dates of vaccine by the federal government, there's no reason to hold those booster shots in reserve in freezers all across the province. On the contrary, given the spread of COVID, it's wiser to vaccinate as many people as possible, as quickly as possible, with the certain knowledge that the federal government has more vaccine on its way to provide for those booster shots. How do you respond to that?
Well, Harry, I can tell you that those discussions have been happening across the country with our counterparts 3 times a week. Many hours have been spent on this topic, as well as with our provincial teams. We've actually done the modeling to show if we did it that way, would we achieve the outcome that we want? And the consensus here in our province, and we're very comfortable with that at this time, is that we are following the guidance that NACI has provided for us. We are sticking with the interval that they are recommending for vaccinating people. We do live in a province where the weather can really get the better of us. So we're trying to be wise with respect to, providing the best benefit for New Brunswickers at the population level, knowing that there is a limited supply. Yes, we are getting more. But again, I think that nobody will fault us for being cautious in the sense that, whether it's 6 weeks, 7 weeks, 8 weeks, we're talking a difference of, a week or 2. And so I think that based on what we've accomplished so far and the work that we've done collectively so far, and again, it's an evolving situation, and we are very excited to get more doses sooner rather than later. There's nobody happier on this planet about that. But again, we are sticking with the plan that we have rolled out. We've been working on this plan since July, and it continues to be modified because of the new information. And anything that comes out of NACI, we will continue to incorporate into our information and decision making.
Thank you, Doctor. Margot Castada, Aquabari, Radio-Canada.
Margot Castada, Radio-Canada. The question is for the Premier. There are some people who are lying or not cooperating with public health. Apparently, they can have a fine of $292. But if someone admits to not respecting the rules in a contact tracing call, can they have repercussions? Maybe if they didn't properly self-isolate.
Short answer would be yes. If we find people not following the rules in any category at this stage, they can be fined. They can be ticketed because we have to have adherence. And the sad point, as Dr. Russell just pointed out, is that the vast majority of people are protecting themselves and others, and it's the flagrant violations that are causing the risk to us all.
Merci, Margot. Rachel Caves.
Yes, this is for Dr. Russell. Extraordinary news about the vaccination efforts at Parkland St. John. I'm hearing from families who are quite desperate to hear more detail. We assume this is Moderna. I guess Lilly Court and Portland Court are excluded. Will people have to show a negative test? What will it take to get into that queue?
Well, I did go through that in detail in one of my other answers. I can just go through the same answer again. Again, it's based on the fact that we weren't planning to vaccinate people in settings where there were outbreaks. However, now that we are, we need to make sure that the work that's already being done in terms of cohorting people and self-isolating people and infection prevention control is done properly. And again, I have received emails in my inbox, so I do know that people are really worried and really concerned and really want the vaccine right now. So we are going to do the vaccination with the exception of the most affected units. And again, I know this is disappointing and frustrating and anxiety provoking. I am aware of that. But again, we will continue to be prioritizing based on risk assessments, whether an area, whether a whole facility or areas of a facility can be vaccinated during the outbreak. So we're going to keep looking at that, but we're trying to do what's safest for those residents at this time. And I do want to acknowledge Harry from CBC had asked really about whether or not we wanted to make any changes around the fact that there are doses in freezers around the province. As I mentioned, we are following the National Advisory Committee on Immunizations guidance, whether to extend that interval or not. And we really reserved any of that approach really from an operational perspective with respect to weather and unforeseen circumstances that way. So again, if we do change anything, we do have the flexibility of changing our approach, but at this point in time, we are really wanting to give the vaccine at a time when it can be the most effective. So again, we're following the guidance of manufacturers and NACI and providing that second dose of the vaccine at 28 days. And again, we did do some modeling to show, okay, what if we gave it all the doses immediately and what that would look like. But again, based on our assessment and our analysis of all of the information around the doses that we will have available, it really wasn't, and Premier Higgs was actually in part of that conversation. So the COVID-19 cabinet is aware of all the information around our prioritization and utilization of the vaccine as those doses come in.
Thank you, Doctor. Thank you, Ms. Kay. Paige Woodard, Mayor Michelle Leader.
My question is for Dr. Russell. Can you speak to what you're seeing in Zone 7 in terms of testing rates and why you believe this zone continues to be an outlier with no confirmed active cases?
Well, let's be clear that any zone that has 0 cases is only a reflection of what happened about 7 days prior. So I can tell you that 7 days ago, there was nobody in Zone 7 that was positive for COVID-19. And in terms of the testing parameters that we look at, up until January 11th, we had, between December 11th and January 11th, we had 2 cases that were positive in Region 7. We conducted 1,319 tests, which is a 0.2% positivity rate, and that's 4.15 per 100,000, which is well below the target that we're looking at. So again, COVID can happen anywhere in any zone at any time in the province, and it's really a snapshot of what happened in the 7 days prior. So all I can tell you is that 7 days ago there were no positive cases, but that doesn't mean that tomorrow some couldn't pop up. And again, it would mean that they'd been circulating in terms of being contagious in that area for a few days prior. And it is the lowest testing area of New Brunswick.
Thank you, Doctor. Thank you, Ms. Woodard. Adam Harris, Brunswick News.
Thanks, Bruce. Question for Premier Higgs. Premier, Correctional Services Canada has begun the rollout of vaccinations to high-risk inmates in federal corrections institutions. I wanted your take on that. There's been some criticism of that decision across the country from conservative politicians who believe regular citizens should come first. Others have said it's the humane and the ethical thing to do. I just wanted your thoughts.
Well, it's, I guess I'm not aware of the federal program, and we haven't discussed it as a caucus or a COVID committee, and I'm sure it's something maybe public health have looked at. So I'm not going to weigh in on the federal, what their requirements are. I think that in this process, we've identified the vulnerable groups, and at this stage, that would be whatever category they fit into. But I think we can have that discussion within our team and with public health and see where the provincial position lies.
Thank you, Mr. Hears. Thank you, Premier. Daniel Edwards, Canadian Press.
Hi, yes, I just have a question about the notice of the Dollarama stores that were closed across the province. Is there any information about how the stores were possibly exposed to the virus?
Well, when public health is involved in investigating cases, they deal directly with the organization in terms of talking about risks and how to mitigate those risks. So public health ordered the 9 Dollarama stores to be closed for 48 hours due to a possible workplace exposure to COVID-19. And those Dollarama stores are located between Oromocto and Edmundston. So at this time, it's not believed that there was a risk to the public, but out of an abundance of caution, the stores were ordered to do a deep cleaning before being permitted to open again.
Thank you, Ms. Edwards. Thank you, Dr. Simon Delattre.
Simon Delattre, Acadie Nouvelle. It's for Dr. Russell. I have questions about the vaccination clinics. Are elected officials among priority groups? And if so, which phase of the vaccination program will they be in?
Simon, peux-tu répéter ta question, s'il vous plaît? Oh.
I wanted to know if MLAs and members of the government will be included in priority groups for vaccinations, and if so, which phase of the plan are they in?
We've had some discussion about that, and I guess at this stage, we've been taking all the precautions according to the public health rules. So I don't see, us being in a priority situation, and I'm certainly not going to place myself in one. So we will follow the protocol as exists today, as outlined and as agreed to by our entire Cabinet and COVID Cabinet Committee. And at this point, no special rules for elected officials.
Merci, Monsieur Delattre. Gilles Duval, TVA.
Gilles Duval, TVA. Hello. From Dr. Russell's speech, are you saying that there is a case of COVID-19 at the Jodin residence, and have we found the source? Yes, there is a positive case. So our team is on site to do some testing. This is what we do every time there is a positive case in a care home. So we're investigating the situation now. Sophie Desautels, Radio-Canada. My question is for Dr. Russell. It's January 14th. We had predicted that holiday gatherings would lead to an increase in cases for the first 2 weeks of the year. Public health, except inaudible comment. Some people think that gatherings were the cause of the increase in numbers. What do you have to say to that? And how did you calculate that? So you're asking about the yellow phase when people were allowed to have a gathering of up to 20 people, including inside your household? So how did you calculate this number? Some people think that this is too high a threshold of number of people that can come over. Yes, well, some people even went in smaller gatherings, but they went with symptoms because they didn't get tested. So if you go to a gathering and you have COVID-19 symptoms, that's when transmission happens, and it happens to all of the people at the gathering.
Thanks, Bruce. My question is for Dr. Russell. Today marks 2 weeks since New Year's get-togethers. Do you think we're going to start seeing a slowdown in the number of cases in the coming days, or is that still a wild card you're concerned about?
So when we saw the New Year's, the Christmas Eve gatherings and the cases associated with that, we knew that, okay, with those close contacts and the transmission we were seeing, it would take at least 2 weeks before we would see the outcome of that. With the New Year's Eve gatherings, we knew again we're going to see another 2 weeks of what that transmission is going to be like. But then we went into the orange phase of recovery all around the province. And so that was supposed to help with, somebody has to mute their mic. Somebody has to mute their mic. S'il vous plaît,
Please turn off your mic.
So we haven't seen a plateau yet is the unfortunate part of the story here, which means, and what we've seen and analyzed, is that there is transmission happening after the orange phase restrictions were put in place that really shouldn't be happening if everybody was following the orange phase of recovery guidance and restrictions. So this is the problem. It's only a small percentage of people who are not following the guidance, but the problem with COVID-19 is that's how it exploits those cracks in our compliance. It will take every opportunity to spread, whether we like it or not. So I know nobody means for COVID to spread in their community. Nobody means to bring it to their workplace or a gathering or their household, but it is happening. We expect to continue to see travel-related cases, and we do expect that if we continue to try to mitigate the risks around travel, getting the travel guidance and restrictions as tight as possible, getting self-isolation requirements as tight as possible to protect people and their households, and have people self-isolate separately. That will be something else that we can do to protect ourselves right now. But again, unfortunately, we haven't seen a slowdown. I don't know when we'll see a slowdown. We are having discussions every day about what else we can do to help with the compliance. So that's why we're engaging our partners at Public Safety to help us right now. And as the Premier said, it's not that we're going to be educating people now. It's now that we are taking this as something that is so serious that it's affecting people's lives, it's affecting people's livelihoods. So we can't afford for a small percentage of the population to not comply when most of the population is complying and are doing everything they can to be diligent at this time.
Thank you, Ms. Urquhart. Thank you, Dr. Tom Bateman, Brunswick News.
Good afternoon. For Premier Higgs, please. I just want to ask about mandate letters for your cabinet. I think, we've become used to seeing these letters released publicly in from recent federal and provincial governments. And based on an interview with the minister before Christmas, I was expecting to see similar letters for your cabinet. Will this happen? And if not, can you kind of clarify why and perhaps provide your views on the usefulness of these letters being released to the citizens? Thank you.
Well, generally, they weren't very useful at all. They're usually quite generic, and you'd have to read the heading to tell which department it was actually in. So I didn't find them too effective, and so my discussion with department ministers in relation to what we're looking at in each department, is one that we have, routinely, I guess, as part of our caucus and cabinet meetings. And in the case of Mr. Land, yes, we did discuss mandate letters, and certainly he would be familiar with that process as part of a routine. But there's a lot of routine things that I don't necessarily subscribe to, and I guess I'd like to certainly make good use of our programs. And in the case of Minister Land, the municipal reform and his plan to, he'll be talking more about that going forward. But looking at the plans that we've discussed, and that he's going to be visiting all the communities and has done a lot of that right now already, but certainly not anywhere near what the hopes would be, especially if we can get out of COVID. It'll be self-explanatory of like his mandate and what he's looking at doing, and how we're engaging communities to have more local governance and more autonomy in communities to help progress their future. So, long-winded answer that I haven't seen mandate letters that have been issued from governments very effective.
Thank you, Mr. Bateman. Thank you, Premier. Teresa Blackburn, River Valley Sun.
This question is for Dr. Russell. You and your team visited Woodstock this week. What did you witness related to compliance, and what are the advantages of being on the ground in a community rather than conducting meetings, say, with local leaders by Zoom or other electronic means?
Well, I wasn't really there to observe anything about compliance. I was there for community engagement. Leadership in communities that have outbreaks and are seeing challenges with respect to public health measures being adhered to or understood. That face-to-face interaction is really great for relationship building, and it's really great for, again, showing that we are working as a team. We are working collaboratively and collectively, that there is no stone left unturned in terms of our approaches to try to help communities get through an outbreak in the orange phase without having to go to red. I did just get an email from somebody saying, why aren't we in red? Well, again, red comes with a lot of serious implications. And as we saw with the Zone 5 outbreak several months ago with Camilton and Dalhousie, we did see transmission happening after the orange phase restrictions were in place. We did go up and engage with the community leaders at that time and local media to really help pinpoint and target the areas that needed to improve to get them out of that situation in a timely way, to prevent them from becoming overwhelmed in their community, which then has implications all over the province. So we were there to listen. We wanted to hear the concerns that they were hearing from their citizens, and also to share our messaging with the leaders so they can amplify it and help reinforce it. And I do hope to go to Zone 4 very soon. It could be as early as first thing tomorrow morning, so we are working on planning for that.
Thank you, Ms. Blackburn. Thank you, Dr. Tim Roselle, Global News.
Hi there, my question is for Premier Higgs, and it's more of a follow-up to the earlier question about maritime bus. Just wondering if the Premier could address how and if the provincial government will assist maritime bus in its current situation.
So I don't really have the details of exactly how that's going to happen, but I know the discussions are underway with the municipalities and the joint effort there of identifying the needs and the routes that are important to keep open. And I would guess that'll be resolved sometime, certainly in the next week. And that that we will be able to use restart funds that are available to communities as part of that initiative, and restoring a service or continuing a service that the municipalities are identifying as certainly needed, not only during COVID, but at this time.
Thank you, Mr. Roselle. Thank you, Premier. Marie-Ève Brassard.
Marie-Ève Brassard, Radio-Canada. Oh, she's having some connection problems. I'm jumping in. Is there going to be a mass testing activity in Madawaska for NATO, Pulp, and Westco? Hello. So I had conversations yesterday with the medical officers in the region and with public health officials. The information that I got is that there were some cases in NATO There will be testing in that company. Testing should take place tomorrow. These are the details I have from public health teams at this time.
HMA.
Hi there. This is for Premier Higgs. We've heard lots of case numbers in communities along the Brunswick borders. We also border with Nova Scotia, where there are currently 32 active cases as of today. In the communities near the Nova Scotia border, it's commonplace to go to Nova Scotia for various healthcare needs, including specialists. And since January 8th, anyone doing that is now required to do something called work isolation, which they can be released from after 2 negative tests. And there's also a new requirement for weekly testing in kids that need to cross the Nova Scotia border for custody arrangements. Also something that's not uncommon around the border communities here. Yet in order to get a test, people in this region need to travel to Moncton. So I'm wondering if you are or will consider increasing access to testing sites in these border communities and or tweaking some of these new border rules as they apply to the Nova Scotia border.
So we have worked with different cases of essential workers traveling back and forth across that border and other borders for that matter. So I think if there are individual cases, they should put in that request so we understand what that looks like and how we can maintain the rules but still provide some coverage there and the testing needed. Because our goal is not to make life impossible for individuals, it's to just find a way to work safely and keep working. So I would encourage them to contact directly through our COVID website, and we'll deal with the individual cases.
Thank you, Ms. Butler. Savannah Odd, Telegraph Journal.
Hi, my question is for Dr. Russell. You've mentioned several times that people are going to work with symptoms, and this has contributed to our current situation. That issue has also been raised by Toronto's Medical Officer of Health. She argues that Ontario should be providing workers with paid sick days because low-income people really can't afford to miss work. Do you recommend New Brunswick provide a certain number of guaranteed paid sick days to curb this trend of people going to work with symptoms? And if you don't recommend this, can you explain why not?
I may let the Premier answer that one, actually.
Savannah, could you repeat your question, please?
Savannah, Ms. Odd, can you repeat your question?
For sure. So Dr. Russell has mentioned several times that people have been going to work with COVID symptoms, and this has contributed to this current situation. And it's an issue Ontario is seeing as well. One of the medical officers of health there has recommended providing people with paid sick days because low-income people can't afford to miss work. Is there any recommendation at this point from public health, I guess, to New Brunswick to provide a certain number of guaranteed sick days? I guess Premier's plan trend of people going to work sick. And if not, I guess, can you explain why you wouldn't pursue that?
So there was actually a program in place, and it was supported federally for additional sick time. So that already exists. So I don't know if and there was a limit on the numbers, so I don't know if we've gone beyond that or not. But I also am aware of cases where someone, has felt symptoms and didn't want to lose a day's work, or they took a day's work off to get tested, and then they lost money. So I mean, there's a balance here that we expect people not to go to work if they have symptoms. We expect people to be fair and honest about the symptoms they have and the need that they need to stay off. So we need to do two things. One, I think they shouldn't lose a day's pay. The other is I think we need to test them promptly so that they're not waiting for tests. So again, as I mentioned earlier about the crossing the border and workers every day, I'd like to know individual cases, individual circumstances, because as Dr. Russell said earlier, we cannot have people going to work with symptoms. That is a problem, and it's critical right now. So if there's an issue there's a particular issue, there's a concern from individuals, we do want to know about it, because we will work with individuals to do the right thing.
Thank you, Premier. Thank you, Ms. Odd. Michael Staples.
Yes, Dr. Russell, I realize you've already answered part of this question already, but how concerned should people be about the temporary closure of the 9 dollar stores in the province, and what advice can you offer people who have visited these locations?
I think if everybody acts as if they have COVID all the time, and if they act as if everybody around them has COVID all the time, they shouldn't be concerned. If you have symptoms, get tested, period. If you go out in public, wear your mask and stay 6 feet away. Disinfect your hands. I mean, these are the things that we have been preaching for months now. And if anybody went to the dollar store and wasn't adhering to those those guiding principles, then, you know, again, I think we all have a responsibility here. Individuals have a responsibility here to protect the larger population, because that's really the only approach that works. That's really the only thing that's going to get us through this. So if you were at the dollar store and you weren't wearing your mask and you didn't disinfect your hands and you didn't stay 6 feet away from people, then yeah, I would be concerned. If you have symptoms, please get tested no matter where you are in the province at any time. Please don't go to work if you have symptoms. Please don't go to school if you have symptoms. Please don't visit anybody, anywhere if you have symptoms. Stay home.
Thank you, Doctor. Thank you, Mr. Staples. Ladies and gentlemen, mesdames et messieurs, voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you very much.